Now, this pandemic is testing all of us, medicos, governments, workplaces, communities and, yes, the media. There are plenty in the media who seem to want to run the coronavirus response, even manage individual cases and decide whether federal cabinet should have gone into isolation after Home Affairs Minister Peter Dutton tested positive.
Minister Dutton says the symptoms were Friday morning, but were they the harsher symptoms with lighter ones presenting themselves before that? It's so uncertain, it seems.
Well, yeah, look, I'm not an expert, none of us are, and I'm going to stick to the official advice on this one. Because
the World Health Organisation or the advice we're getting
either or.
At a domestic level? Because the World Health says 48 hours, whereas the Chief Medical Officer tells us 24.
The Cabinet was 72 hours before he reported crook. So
the World Health Organisation says it is possible to catch COVID-19 from someone who has, for example, just a mild cough and does not feel ill.
Is this insiders or Grey's Anatomy? Of course commentators critique and suggest government action, that's my caper too. But running pandemics might be best left to the experts. What's their view on the Treasurer's precautionary test and subsequent all clear?
Medical advice to me was not to go and self-isolate, and so I'm pleased that the test came out negative.
Phil, should he have self-isolated? I'm glad he doesn't have it.
You're asking Dr. Curry, the journalist? Yes. I looked up, I knew you'd ask me this, so I looked up the protocol and he followed the protocol to the letter in terms of, there's a flow diagram, if you've got this symptom, no, yes, blah, 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 and it goes right to the end and it says, if yes, testing is still not recommended for you unless you've returned from overseas in the past 14 days. So he actually followed the protocol to the letter. Whether maybe he should have isolated himself until the test results came back, it's not stipulated in the protocol, so that's a discretionary decision.
That's a relief, isn't it? I wonder if Insiders has a Medicare provider number. Still, we were told the public apparently are confused.
Prime Minister was saying, on the one hand, go about your business as normal. I'm going to go to the footy because I might not be able to in future. But on the other hand, your whole world is going to change from Monday because things will be cancelled and restricted, and we're encouraging you to change your behaviour.
It's too dangerous after Monday, but it's OK right now.
Really, do journalists think that people need to be told exactly what to do day in and day out by the government? Common sense never kicks in. If crowds are about to be banned at footy matches, I think adults are able to make up their own minds. But a lot of journalists thought Morrison's footy intentions were too much for the poor public to understand.
Prime Minister's colleagues say he's taking the pandemic seriously, but he's keen to avoid panic and hysteria. And that was what the ill-intentioned idea to go to the football was about, I guess. But compare that to Boris Johnson and Gladys Berejiklian, and it's probably time to stop trying to be clever and agile and second guess and just play it straight.
It's a bit of a non-issue, surely. But back on Insiders, so keen on decisive action, they then demanded to know why on earth Cabinet officers were disinfected after Dutton's diagnosis.
The virus probably doesn't last for more than a few hours.
So why were they scrubbing it down?
I'd have to check with the people around that.
That wasn't a decision I'm aware of either the Chief Medical Officer, and I'm not aware of any Cabinet involvement in that. So
someone's decided that there's enough risk to send in fully clothed cleaners to scrub down the whole area.
Yeah. So
they didn't need to do that?
Can we step back a moment here? We are now heading into an unprecedented situation, not something that any of us have experienced in our lives.
Yeah, how about we step back a bit instead of the media micromanaging of the situation? The Health Minister wants to talk about the pandemic, you know, the measures, the challenges ahead, what's important for Australians. Will the government or any authority get everything 100% right in this situation? Of course not. There's no perfect response. We could all lock ourselves in our rooms and stop infections completely, but society would not function. But journalists seem addicted to finding a slip-up or getting a government ruling on every daily decision of every person.
You're saying it's very clear. It's not, is it?
The advice is clear. Sometimes people, interpret the advice overcautiously, but our advice has been absolutely consistent the whole way through.
I do think there's a very important thing here, and I would not want some of the non-medical people who might be sitting on the panel to be giving medical advice to the country.
Sure.
And obviously I'm talking to Peter. that I think it's very important that we listen to the medical experts, and why this is important is to make sure that the right people are being tested.
And we're going to get to the medical questions
I would like to proceed, please, David.
Sure. You're saying it's OK to go to the cinema today. What about the gym? What about riding on a train? If you have to catch the train to work, takes you an hour, is it OK to be on that train? If you're over 70, should you stay at home? I get your point that it's important to look at the long term, but right now people don't know whether to go to the restaurant
and I will
or the
address
supermarket.
that.
But we felt that it was time to make the decision to give a bit of time for adjustments.
But not this weekend, so it's OK to go to the footy today, but not tomorrow?
These things are they're not black and white.
So the media slams the government for poor communications while it's obsessing over petty issues. My hunch is the public might be more interested in slowing the pandemic.
The rule for the country is being set out clearly now, and it's important that we follow the medical advisors
you do accept
and not the armchair experts.
There's slightly different, well, armchair experts perhaps.
Information is everywhere. We know many people will be infected. Thousands will end up isolated, home from work, home from school. Some will be sick, some will be critical. Many will lose work. People are stocking up, they're getting ready, they're washing their hands, not socialising. Could political media coverage break free from its bubble?
There's a little bit to unpack from what we just heard right there, including a bit of a go at you, Peter, along the way. Basically making the point, we need to listen to the Australian infectious disease experts. That's what they're doing. That's what their advice is based on, not armchair critics.
Well, yeah, the Minister, I was gobsmacked that in such an important time as this, he would choose to get personal in an attack and also misrepresent, suggesting that what I'd said was providing armchair medical advice. Nothing that I said was medical advice. I was talking about inconsistencies in messaging.
Channel 9's Harry Clark saw this and tweeted to Van Onselen, "This crisis isn't all about you, bro. It is about 25 million Australians, not to mention the rest of the world. This is a unique crisis and our media hasn't seen anything close since at least the recession of 30 years ago. Social media channels everything through a hyper-partisan and hyper-personal lens. But you have to wonder whether journalists continue to do what they've done at elections, and that is underestimate the intelligence of mainstream Australians."
I stayed in a hotel last night. In the elevator, there was a poster with 5 easy points of what you should be actually doing: washing hands, being disinfecting, basic information. Maybe it's here on the website. I can't see it.
Look, the poster sounds fine, but I hardly think we all need it. Surely if we need simple and useful information, it's the journalist's job to provide it. If that's not the job of media in a national crisis, I don't know what the hell is. Here's the Labor Party leader from last Friday.
This campaign has been too slow. They need to do better. The public need clear information.
Aha! You see, it's a political attack. As it happens, radio ads were already running by the time Anthony Albanese said that. Still, the very next day, the ABC's Dr Norman Swan popped up with a community service video.
The ABC is covering this epidemic day by day, hour by hour, with the experts. In the meantime, there are simple things you can do for yourself.
This little video was lauded by ABC hosts. Breakfast TV's Michael Rowland said, "The nation thanks you, Norman," rather grandly. Comedian Charlie Pickering said he was proud to be part of the ABC, filling the void with certainty and trust. And radio's Virginia Trioli said the government's campaign hadn't started, it actually had, and that Swan had fixed the situation. All very proud of their ABC, to be sure. But hang on. This 1-minute video came 47 days after Australia's first infection and almost 2 weeks after the first death. Is this something the ABC should be proud of? It took them nearly 50 days to come up with a little video, and then only after Labor attacked the government for not producing one? Don't the ABC get $1.1 billion of taxpayers' money each year to provide factual, clear and timely information to the Australian public? Yet they bag the government and laud each other because they made a YouTube clip? You have to wonder who's in charge. And yet now, rather than reporting the experts, the ABC is promoting its own response to the pandemic, with Swan advocating alternative policy prescriptions, including immediately shutting down schools.
I do think that a severe shutdown is required, and it may not be for quite as long as we need because we'll get on top of it more quickly. But now's the time to do it when we've got small numbers.
Look, at least Swan is a medico as well as a journo, but is this his job? Does this help or hinder? Another ABC presenter, Yumi Steins, not a doctor as far as I know, is telling people to keep their kids home from school. Parents will make up their own minds, but why is she the one to offer advice? And some of Swan's contributions are highly contentious and possibly alarmist.
It turns out that there are plenty of people dying in their 30s and 40s in Italy and China. This is a disease which also affects young people. And those young people have no obvious risk factors for serious disease or death. They've not got heart disease, they've not got diabetes. It's actually quite scary.
And yet, with all this going on, the Labor leader, who you remember his line on communications was so actively taken up by the ABC, well, he's now returning the favour.
There is a lot of misinformation out there online. Get your information from credible sources such as health.gov.au and the ABC.
How about that? Now, of course, no one has a mortgage on the truth, and information is vital. I'd just rather put my faith in official advice and the common sense of the public rather than pandemic management by journalistic decree.